Good morning. I am Dr. Aki, an interventional pulmonologist at National Jewish Health and also the founder of EON, which is donating our mission critical safety net solution to more than 4,000 hospitals during the COVID surge. I'd like to thank you guys for joining the daily debrief. And today we're going to talk about essential patients, who they are, why they need us, and what we're going to do to help them. So the first thing that we like to do is check out the essential patient and deferred patient data for today. I'll take you there right now. And if you just go to www.eonhealth.com, that is most certainly the easiest place to obtain the latest data. And as you can see, I'm just going to do that right now. So if we just go to the diversion curves, here you can see the diversion curves, and we'll look at today's data. So today's data shows that, again, 1.8 million office visits have been deferred. 30 million patients to date have missed or have had delayed office visits, with approximately 6 million of those falling into what we would define as essential, which we are going to we're also going to show you what that means in terms of what is the definition of an essential patient. About 195,000 procedures have been missed. I also have some reports about why those procedures have been missed and what we can do to improve that. Just looking at the curves again, here we're keeping the default hospital efficiency level at 90%. That'll return at sometime in June. And you can see, you can scroll to determine what those diversion rates are. And the blue is the diversion rate that gets down to 10%, as you can see here in July 1st of 2020. If we were only able to get to 90% efficiency ratings, you can see at the end of the year, if we were to go to December 31st, that there's still approximately 9 million essential patient visits and 46 million office visits that would be missed. And if we're looking at procedures as well, very similarly, working through the backlog is going to be very, very difficult for the majority of hospitals. So let's jump into what an essential patient is. And what an essential patient is, by our definition, is anything that would affect or threat a patient's life. If there's a threat or permanent dysfunction to an extremity or organ, risk of metastasis or progression or staging of a disease or a condition, and a risk that a patient condition will rapidly deteriorate if the procedure or surgery is not performed. So let's go through and talk about how we've triaged our patients, at least in the pulmonary service line, and what we've done for clients as well. So this really is what sparked the essential patient reports. And let me show you an example of what an essential patient report is and how you can start to triage your patients and determine who you want to get in earlier versus who can likely wait. And then you can triage to where you want to have throughput that doesn't consume PPE. And I can definitely describe that and tell you what's going on and why it's very difficult to get throughput in service lines that are outside of disease states that are COVID related. So let's start with this. As you can see here, this is a sample of a essential patient report. And let me make it just a little bit bigger so you guys can see here. Perfect. And so the way these reports are listed out, this is a lung cancer screening cohort. These are screening patients in which levels of risk are based on different risk categories. And so 4X being the highest risk, 4B being the next highest risk, 4As and so forth, as you can see. So the top of the list is showing patients in which what we say is non-adherent. Non-adherent is somebody who had a baseline exam. So if we look at column G here, we can easily see when their last exam was performed and then when the expected date was previously. And then we put a buffer in that's based on whether or not the patient is at risk of never following up ever. And for a 4B, that's, it's a 30-day a time period, but we really put 4Bs and 4Xs where immediately after those are found, that something needs to happen next, because likely that patient's going to need a PET scan, a tissue sampling, surgical consultation, or at a minimum is going to need some sort of visit to determine what is the correct next step for that patient. A 4A is going to need a PET scan or a 3-month CT scan. If the patient does need a PET scan, then you'd need to get that patient in now versus opposed to 3 months from now. 3s that are coming up that are due or overdue and at risk of being non-adherent should most certainly be seen. In addition to your patients that are incidental, that are greater than 8 millimeters for sure, if they are due for a follow-up, would need to be seen. And we'll talk about that too. Most people are diverting patients that are lung RADS 2s or lower. So you can see the 2s and the 1s in terms of lung cancer screenings are being diverted. And so this is just an example of an essential patient report in terms of lung cancer screening, how it really breaks these down into highest risk versus lowest risk. And then we also run our Eon Endu platform through there to extract out different nodule characteristics like size, laterality, and location. And then also we look to see whether or not there is something that is scheduled or expected. And if it's in the future, and let's say that this patient here is a 4X and it's 412, well, obviously we didn't get a result for this particular patient, and this is a patient that would need some attention because it's a 4X. And so this report makes it very easy to navigate patients that, and this is just an example of patients who are incidental patients, and you can see that the lung nodule size is on the right-hand side, and we're breaking those down in terms of biggest nodules to smallest nodules. So that's just an example of a essential patient report, and just wanted to show you guys exactly what that essential patient report looks like. So in terms of what we're trying to do with the essential patient report is that at first we just wanted to ship out reports very quickly that we could focus the nodule coordinators or your service line to manage those patients first. Now, what's been happening is that rightfully so, PPE is diverted to frontline COVID providers and staff, and that's the right thing to do. However, what makes it very difficult is that a patient who needs a procedure for diagnosis of lung cancer or other types of cancer, doing those procedures, you have to assume that every single patient has COVID. And so what that does is it creates a throughput issue where normally where you could process a patient in a prep room and then take them to the procedure room, have them leave as soon as the procedure is done, and then go back to the recovery room, that makes it very difficult because you have to have a process in which the patient is presumed COVID positive, right? Because we don't have adequate testing for that setting as of yet to be able to test patients and separate out patients who do test positive versus don't, and have a very fast throughput where you're not going to consume PPE. So think about it. Everybody who enters and exits the room is going to have PPE. The room in terms of turnover is going to be slower. So where you could do, 6 to 8 bronchs in one day at least, if you lined them up properly and you did good room turnover, now you're looking at maximum half that, and you're consuming PPE. So that's really the problem in terms of why we're seeing a diversion of care, and also why we're seeing this bolus of patients that are going to create what we call, the essential deferred patient curve, which on the website, if you look at it, is that red curve that shows 58 million patients that are office visits and over 190,000 procedures. So this is what an essential patient is, and this is also what an essential patient report is. We've taken it to the next level, which is safety net, in which we can easily take a quick VPN with the HL7 result feed and create essential patient reports, tie that to our mobile app, which is Safety Net, and allow you to start addressing those essential patients immediately. Now, once we work through the 20% or so patients that are essential, you still have the backlog of what we say are, everybody's an essential patient. So every essential patient, but the 20% in which if you waited, 60 to 90 days to see those patients, those are the patients in which you have extreme, risk of mortality and morbidity. However, the others do have an increase mortality and morbidity as we continue to push them off. So they will become essential at some point. And so what our process is and our is that we want to help hospitals address patients that are essential and need to be seen now. And that's why we're offering Safety Net free of charge until June 1, where if you sign up, there's a Friday deadline. We'll get you activated by the next Friday, and then you'll have these EPRs and you'll have access to Safety Net. We want you to get those patients in now because there is a time crunch and the time is really counting down. The second thing is that we also wanted to do it with very low impact. We're SOC 2 HIPAA compliant. We've gone through enterprise architecture boards. We'll take your BAA, and then we have a very simple service level agreement with a packet that's very easy to execute with not much burden to any of your contracting teams, which are really busy, or your IT team, because everything is AWS hosted on SOC 2 compliant, HIPAA compliant, dedicated servers that have been enterprise validated through and through. So tomorrow, what we'll be talking about is more about Safety Net. We'll also be talking about some of the economic impact. We have reports of Mayo Clinic, which has a reported $900 million loss in 1 month due to COVID, and also 10% decrease in pay across the board. We're going to wait to validate that information and also report on that tomorrow. We'll start to report on some financial data as well. Really appreciate everybody joining in today. Looking forward to talking to you guys tomorrow. Remember, we must restart the hospital engine and get back to our primary objective of patient care. Stay safe, stay distant. Make sure you see your essential patients. More tomorrow. Thank you.